Rhythms originating in the sinoatrial node. Normal sinus rhythm. You can't see the large box versus small box divisions on this, so this is going to make it very tough to talk about it on these slides. Normal sinus rhythm, sinus bradycardia, and sinus tachycardia are all just 3 variants of sinus rhythm, okay? The only difference is this one is more than 5 large boxes, this one is less than 3 large boxes, and this one is somewhere in between them. Clear? Yep. Okay. Sinus pause, that means you were going along and you had nice normal P waves occurring at some regular interval, and then the P waves just stopped. Boop, they're just gone. That's a sinus pause. Premature atrial contractions mean that you were going along in sinus, and then you have a little squiggle, boop, somewhere either in or right after the T wave, usually pretty pointy. And then you see another narrow, here's the key, narrow QRS after it. That's a premature atrial contraction that made it through the wiring and managed to trigger off another beating of the lower chamber. Okay? This is very different from a premature ventricular contraction. What's the difference between the two? How do you tell the difference on an EKG?
Ventricular contraction is going to be wide.
That's right. A PVC is a wide beat. That's more than 3 little boxes. If the QRS is wider than 3 little boxes. A QRS should be less than 3 little boxes. Okay, less than 120 milliseconds. Okay, sinus dysrhythmia is something most of you in this room will have because you're in excellent physical condition and you're relatively young. Okay, sinus dysrhythmia or sinus arrhythmia is just fluctuation in the heart rate as you breathe in and breathe out. What it reflects is how good your vagal tone is. The more you work out, the more fit you are, and the younger you are, the more your body is dominated by a vagal state. You want to be in a vagal state whenever possible, okay? Vagal states are great. You live a long time in a vagal state. If you're on adrenaline 24/7, you're going to die of a coronary in your 50s, right? Okay? So when you see this, this is actually a healthy marker. You're like, all right, good for you. All right. Supraventricular tachycardia is a narrow, complex rhythm in which you cannot see the P waves. This is not the accurate definition, okay? This is not the precise definition that someone who does what I do wants for supraventricular tachycardia, but it will get you the right answers on your tests, your boards, and in the rig, okay? Very fast rhythm, narrow complex, can't see any P waves, okay? Give that patient adenosine, see what happens, okay? Half the time it'll go away. Please do me a favor. Run strips while you do it, okay? There's nothing worse than the rhythm terminated to adenosine and there are no strips. Thank you. Now I can't see either the rhythm or how it terminated. I've learned nothing that I can use to help that patient at subsequent procedures, okay? Try to get a 12 lead of them when they're going fast. And in the hospital, I get 12 lead rhythm strips. None of your rigs, I don't think, can run continuous 12 lead. So at least get a continuous 1 lead rhythm strip of the thing terminating. Okay? Great.